So usually babies whose moms are on drugs when they're in utero, if they are born prematurely, they actually are less likely to develop withdrawal. So the term babies, so babies are born when they're supposed to be. We watch them for at least 5 days in the hospital before they're sent home if we know that mom was using any sort of drug substance that the baby could withdraw from. So usually it depends on what the substance was and how long it usually stays in the system for how long it takes to see the withdrawal symptoms, but that's why we watch them for 5 days. So we have a scoring tool that we use, and the babies get scored after they eat, about a half an hour to an hour after they eat every time for those 5 days, and we monitor to see if they hit a certain level that shows us that they are withdrawing. Just because mom is using drugs during pregnancy doesn't necessarily mean that the baby will withdraw. And even the same mother can be on the same drug in 2 separate pregnancies, and one baby can withdraw and one might not. So it's just monitoring them on that scoring tool to see what different symptoms they show. And then trying to, if they are starting to show symptoms, trying to do things that wouldn't be a medication to control it. So things like making sure you're feeding them frequently, but smaller meals, smaller amounts. So having them swaddled tightly, having a pacifier, holding them, decreasing the stimulation, so low lighting, trying to decrease the noise in the room. Things like that to try to help prevent them from needing to go on to medication to work themselves through the withdrawal. It usually takes about 2 or 3 days for us to really see them showing signs. So they're generally very irritable. They have what we call a high-pitched cry, so their cry is a little more shrilly than normal babies. They can't soothe. Like, you'll try to offer them a pacifier and they just they're so overstimulated that they can't actually suck on the pacifier. They could not eat well. Sometimes they, again, because they're just the way their withdrawal presents, they're not eating well, so it's kind of similar to them not sucking on the pacifier, And then they can have be throwing up, have loose stools. Sometimes they have really bad we actually frequently see them have tremors, so they have shaking of their hands or their legs. So that's a pretty frequent sign. Worst case, they can have seizures. If it's left untreated, they can die from it. It's different than an adult. You're not going to see them die from withdrawal, but babies can. When the moms are on multiple substances, that the babies usually require more treatment, longer treatment. So if they're on different classes, so a Percocet and a Xanax would be 2 different kind of classes of drugs. So if they're taking both of those, the baby is more likely to have withdrawal and more likely to need medication for longer. There is increase in neurodevelopmental problems, so sometimes developmental delays, but and also ADHD. So there are links to that in the NAS.